Dr. Hayam, as the same question, what does being a doctor mean to you?
When I was in training, I remember taking care of these really sick kids at the Children's Hospital, kids with chronic medical conditions. These were frequent flyers where they would constantly come into the hospital. And that was our job, right? They would come in and we would have to do anything possible to get them back to a normal life. And it would take a long time. And you would get to know these kids too. And you would see that they were just like anyone else. You think that because they're so sick, they must not be able to imagine that they can live a normal life, but they do, right? They just want to ride bikes with their friends. They just want a girlfriend. They want to go to high school and go to prom, and their parents want that too so badly. And when we would take these kids to the operating room, it was so painful because you knew that they were going to be in for it afterwards. But ultimately, the satisfaction of seeing some of these kids go home, right, going through this huge experience, so much pain and suffering. But then you see them a couple weeks after they go home and they're like, they're just a regular kid. So, but what that really was is you're taking a really sick kid and you're making them healthy so that they can go back home and live a normal life.
So I enjoy this because we're getting a little different slice from each of you. So you were saying being a doctor is like being a trainer, which is almost like a coach, and you're there to support them in their moment of need. From you, I heard more being a doctor is more of being an educator. And from you, I heard more being a doctor is really a healer. And I don't know if you all thought about it that way, but you very naturally gravitated towards three slants of what I think being a doctor is. I always thought being a doctor was having superior knowledge, and I don't mean that in any arrogant way, but you go to school for 10 years to possess that superior knowledge. You have superior knowledge, but the knowledge itself, I don't believe, is inherently good or bad. It could be used for good or used for evil, and I always felt the doctors were using their superior knowledge for good. And then I got a little bit alarmed during COVID and now with the transgender, wondering if doctors are taking what should be a neutral positive thing, which is this superior knowledge, and using it for evil, is not what I want to do as a doctor. So I appreciate hearing the trainer, educator, and healer